That's why you're not supposed to include.
Hi, my name's Hannah. I'll be your student nurse today. Can I get your name and date of birth?
Yeah, the mail and
Jose Sanchez. 4/47.
Okay, matches my monitor. Shows I have assistant's orders to change your dressing. Do you have any questions for me about it?
No?
Dirty dressing.
Right, after it's done, to make sure it's not infiltrated. No, you gotta realize what a texture is gonna be. You gotta realize, the thing is you don't wanna touch the surface, like, you're not gonna really feel the coldness, you're gonna see it up higher. Right. Because you gotta realize.
Coca this. So look for the color, see if there's an odor, consistency, and the amount. Also coca this. Coca this. And coca this. I'm not gonna, so I don't ruin it, but we put it in our glove and dispose of it.
Okay. So does that have to be put in one of those red bags, the hazard bags, or no? So I can just go in the garbage.
Drippable, spillable.
Oh, okay. That it's contained. Okay. So you'd contain it in your gloves. Okay.
Well, I guess I could have done that because I'm going to be redoing it.
Oh, when you're done.
Well, like right now, when I take my syringe off, if I leave that open, then it backflows.
Then we're going to clean the wound in order to irrigate with 30. This is still the clean procedure, right? With the water?
Yeah, I think so.
Because you guys will be doing IV when the first semester is doing.
Go check expiration date. Good.
Oh yeah, you try to do it as well. Otherwise you can't see the blood in it.
Put this underneath. Would you be so kind to, could you grab an extra pillow? So you can turn the client.
So why do you have to turn them?
So that way when you irrigate, that it comes.
Oh, so you're going to put a pillow here and elevate them this way?
Yep.
Okay.
Are we supposed to be doing like a skin assessment around?
Yeah, I think, yeah, before you irrigate it.
Okay, so I'm going to do my skin assessment where I can see that there's a little edema, no redness, skin's intact around the wound, no rashes or anything. So we're going to prep the so that rolls out.
Thank you. My doctor, I'll see the doctor for another 3 months.
So I'm going to irrigate with 30 milliliters of water.
So you just let that run out?
Pretty much. Get out of there. And then we got all that. Okay. Now we're going to take a culture.
So can you reach over this or no?
It's not open.
It's not
so
open
you
yet,
can-
so you
you
can't.
can.
Once it's open, you can't.
You cannot. Okay.
Rolling this around.
So are you supposed to roll it up through the entire wound?
Yep,
Yeah.
touch
Okay.
everything.
The whole area.
Okay. And then you're supposed to insert that without touching the rim? Is that
Yep.
the idea? Okay.
I would document on this, put the information on here, and the tube. Now I'm going to measure the wound. So we got 14 centimeters long and 2 centimeters wide. So I document that. Now I'm going to assess the wound. It's red, it's beefy red. I don't see any edema on the inside. What's Rita? Redness? Swelling?
There was one that's not erythema.
Here's the- so that-
Drainage is
drainage.
the D.
And then I don't know what the other E is. I don't have it in my book.
For drainage and the A. Redness, swelling.
Aspirate? No.
I don't remember.
I don't know. Coca, color's red.
Mm-hmm.
I don't smell any odor. Consistency. Oh, am I supposed to coca this or just the discharge?
I think just the discharge. The drainage.
So would you do that when you took off the pads?
So would I irrigate it out is what I would coca, right? So just say there was crap in there, just a small amount.
Is that the Sergonius or Ceruginius and those three that
Oh,
she
serous, serosanguinous, and sanguinous.
Yes. So those three.
So my hands are sweaty. I washed them.
What technique is that?
This is aseptic technique.
This is the blue jean clean.
Yep. Okay, so first I'm going to open my packages. This we're
You're done with that.
except for pouring in there, but I'll do that out of the bottle,
Yeah.
right?
So you re-sterilized your hands, right?
Yep. I washed my hands.
Okay. So now you're prepping for the actual sterile technique. Okay.
I thought it was a poster for Rita. I don't know what it was.
I think it was in the back room in there.
In the
Not
classroom.
positive, yeah, I think.
Alright, yeah, there's one back there.
Are you guys gonna tape your stuff down?
Yeah.
Yeah, I
Put my tape
I
down.
think I will too.
Just because they always fall over.
Not that I would. I don't know if I would in practice.
So
Yeah.
if it folds over then, is it then not sterile or?
It's still sterile. You
As long as
just
you don't
have
touch
to-
that 1 inch around the.
So this is right here is contaminated. That's
Yep.
considered
The
non-sterile.
Yep.
Okay.
I think it's still sterile if it folds back. Back together.
But you can't use your clean hands to touch this, or you can?
You can.
You can, okay.
I guess she said something just like to have better control.
Oh, okay.
I'm just gonna tape it for the heck of it.
Mhm.
Thing is, if it flips back over,
Mhm.
you have to be very conscious of not crossing over your table to lay it back down.
Ah, so that's why she's going around to place her tape, not reaching over it. Okay.
And that's why I have it curved like this too,
Yeah.
so that way I can.
Work
your way
without being
down.
tempted to cross over. Okay.
I know, exactly.
Did you come up with the tape?
Here from first.
Huh?
Did you come up with the tape idea?
No, she did it.
Oh.
The demo.
We don't want to open this all the way,
Okay.
You don't want to expose the swabs.
Okay.
Okay. Now I need to.
Well, we have a board that they're supposed to look at.
Yeah, but I gotta rearrange the board.
Flip my Bible.
Did you already expiration date it? Or?
Yep.
Okay.
Is that enough?
Yeah, then I could, cause with the opening,
What to go in your paper there?
Okay, well that's enough.
So now do you just let it soak itself? You're not actually going to glow up in it? Okay.
Okay, now I'm going to put on my sterile gloves.
Now where do you open your gloves up if you've already... You need another table. No?
She did it on the end. She turned her body around.
And then did it here?
Yeah.
Oh yeah, because you can't turn your back on this now.
You almost want to push everything to the end a little
So
bit.
keep them maybe closer together than what I did. I ain't gonna get this on the first try here. I don't. Hopefully the hand sanitizer will help.
I do that same thing.
Keep it.
So we have to keep it above this, right?
You gotta keep it in this. Yep.
And your
That.
perimeters.
Okay. But do you have to stay over the paper, correct?
I don't think so.
No. No?
But you want to be careful because you don't want to touch the edge of the paper either.
Okay.
Fingers are stuck.
The edge of the paper is contaminated.
I'll fix it once I get my other one on.
Because this one you scoop inside, that one you scoop outside, right? Your second one?
Right. Trouble with that because that folds over.
Mm-hmm.
Pretend I didn't touch that. I need some more practice with this, but
While you're gloving up, we'll introduce the crew. Magic of television.
okay.
So now, can you rid this
I
if
can
you...
touch in the middle.
Okay. The video, she just threw it on the floor.
Okay. First. Dinosaur arms. Open this all the way. I realize it's touching the edge, but he said this one's going to be really hard because it's so little.
Oh, okay. So if it...
Touches outside of the skin, you gotta start over.
Oh, you gotta pull the whole thing out.
Hence why
But
the
that
video's
won't...
so long.
Oh, okay.
Because she messed up.
So you just pull it out, but that won't make you fail.
Right.
As long as you redo it the right way.
Okay.
So you'd have to get another one because you need 2.
You'd have to deglove,
Yep.
sanitize your hands, pull up the bed rail, drop the bed,
Yep.
leave the room, come back.
Oh no, you don't have to do that.
No.
You just have to. You're gonna.
There'd be
deglove.
more of these here in the room.
She said in the video, bring extras. Make sure you have
Everything.
extras.
Okay.
You're gonna deglove, pull, get rid of this without crossing your table.
Okay.
So get rid of this one. You can put a new one down without crossing your table, and then reglove.
I think we should practice with the other one because there's no way I'm gonna be able to do this.
What do you mean, other what?
The bigger wounds, so it's
You should
easier
tell
to.
us which one we're checking off.
I think it's the one over here. And the one she did, right?
Right?
Is it hard because it's not wet enough? Or is it plenty
No.
wet? Or yeah, it was
Because
plenty
it's too thin, and so I'm having a hard time because I'm not
getting it.
good enough at this yet. You know,
Can you, did you wrap that, like roll it?
I kind of like zigzagged it into my hand.
Could you roll it, like kind of twist it, and then do that same technique so it's a little bit thinner?
But you want this to be on the whole entire thing.
Oh, so it has to be through in here too, right? This whole.
Yeah, that's why this is so hard. So
Okay.
I'm just gonna do the one for practice.
No, that's good. That's good.
And what you do is you pull them apart. This one here. And this one here. I'm gonna come back over. My dressing. Okay, and the gloves can come off now.
Okay.
Wash my hands.
Your back hurt?
It's more in my hips now.
Mm.
Back's better, but just sore.
This part you can do without gloves.
That part.
With or without, whatever you.
Oh, she said we could.
Just want to stretch. So then you have to, do you have to sign the tape
Yep.
on these?
Sign a piece of tape and then.
Okay.
You don't really sign it. You do the initial.
Just
Your
initial
initials
and
on a
the
date.
date.
Initials,
Okay.
date, and
Time.
time.
Okay. So is there any, like, as far as technicality, where you have to have these, like, butting up to
Yeah,
one
you
another?
do.
Just so that,
So you don't get anything in there. You want
Okay.
it completely closed off.
so when you do, you want to overlap these
Right. Yep.
and then overlap. Okay.
Yeah.
Wash my hands. Do you have any questions?
Do we have to assess pain on this one? Are you having any pain?
Not on the check off.
No? Okay.
Well, they're bound to have pain while you're doing it.
Right. Yeah.
We were
How'd I
just
do?
asking, are you doing okay? You know, because
You
she
did good.
did it in the video. Are you all right?
Yeah.
You know, are you, I'll be done shortly, or I'm just packing them. Just tell them what you're doing.
That's good. We have, what, 30 minutes to do this?